Hello everyone. Today I'm here with another warning letter that is for Centaur Pharmaceuticals Limited Private Limited. And these pharmaceuticals get warning letter in June 2022, and US FDA inspected these pharmaceuticals 14 November 2021 to November to 222 2022. And this warning letter summarizes the significant deviation from the current good manufacturing for pharmaceutical active pharmaceutical ingredients. And here is the first observation. During inspection, our investigator observed the specific deviation including but not limited to the following. Failure of quality unit to exercise its responsibility to ensure the API manufacturers at your facility are with compliance with CGMP. So the quality unit failed to ensure the adequate document control over the paper and electronic records. Here is the example. That means there are the analytical worksheet, incidents reports, non-conformance reports, batch release copies, reprinted and blank forms are stored in library doors and cabinet with unrestricted accessories and inadequate controls. That means different types of control documents found in cabinet which cannot be stayed there. So they mention another thing, the CGMP document like bank worksheet, analytical worksheets, and they have two types of bank analytical worksheets which are the same number, 2061. So this is a serious data integrity issue. And they also see that the logbook of shredding machines where they discard the documents, and this discarded records however include analytical worksheet laboratory incidents reports and function training records without any record. In response, in their response of the Central Pharmaceuticals state that they state that the pharmaceuticals are consolidated and destruction in order to control the quality into because this is the responsible of the quality control unit. The data integrity concern either in signed and removed from their details. Who are removed the that means the who are responsible for this data integrity issues are not resigned or removed from the duties, and the response is acknowledged that have created uncontrolled documents and destroyed CGMP documents without adequate controls and accountability. Although they now practice uncontrolled documents. You have not identified address and scope extents of your practice discarding shredding critical CGMP. So they said FDA said that their response is inadequate, and they said that the shredding of critical CGMP documents, raw data, analytical worksheet with weights and calculations. Why it's happened? So here also another quality control unit failed to ensure that the that materials are appropriately tested and the results are reported. So they said HPLC system processed unlabeled files, and you could not provide the evidence that these unlabeled vials contain the solution described in the specific system sequence. So, in response to the from observations, Centaur Pharmaceuticals said that the SPSA bias and the second analysis do not conduct the verification of the labeling. Then they said that there is a SOP for good chromatography and analytical practice will be revised into incorporate the bial verification checklist for use by QC supervisor. Furthermore, we plan on providing trainings for bial labeling. So, here, your response is inaccurate. They said that you did not determine its scope the deficiency, and you did not provide the root cause analysis, and finally the effectiveness of your from CGMP training program appears to be inadequate. So this is all for today. Thank you. Next time we are coming with another observations and warning letters. Hello. Thanks everyone.